Hi everyone, today we're going to talk about patellofemoral pain. So the population you'll most commonly see this in is the 20 to 29-year-old, and then you'll see an uptick again in the 50 to 59-year-old, most commonly women. Typically a gradual, insidious onset of pain, and the pain will be retropatellar or under the patella. From our clinical practice guidelines, we know that there are two tests you can do to rule in patellofemoral pain. The first one is palpation. So Megan, your pain is under your kneecap. That's what you're talking about. It's under here. Okay, not along your patellar tendon here. So you feel it under your kneecap. And it increases with prolonged sitting, sitting and driving for a prolonged period of time, and going downstairs, correct? Okay, great. That's one test. The second test we know that will help you rule in patellofemoral pain is an eccentric step test. So I'm going to have my patient with left-sided knee pain go down and do her right knee first. And as you can see, her knee stays nice and straight and you have no pain with that. Now, if you can do the same thing with your left knee, please. So she leaves her left leg on the step, and as she goes down, she rotates in a little bit, and that recreates your pain. And so that would be a positive eccentric step test. We can measure the height of the step, and we can see if the patient gets better by progressing the height of the step. Okay, so Megan, the other thing we always have to worry about is flexibility. So we found some tightness in your two joint hip flexors, your quadriceps as they cross your hip. So what you're gonna do is you're gonna tilt your pelvis, good, and do you feel a stretch through here? Okay, if not, you can bend this knee and that'll lower you a little bit. Now keeping your hips level like that, I want you to adduct your leg a little bit. That will really stretch those lateral structures. So if you're only gonna give your patient one stretch for patellofemoral pain, this is a really nice one to do. So when we treat a patient with patellofemoral pain, we always look at the joints above and below. If we feel the foot is a contributing factor, in other words, we have a patient who pronates a lot and they have tibial internal rotation or femoral internal rotation, we can offer them an orthotic. Research shows that off-the-shelf orthotics are just as good, if not better, than custom orthotics. So don't have your patients spend a lot of money on custom orthotics. Start with an off-the-shelf orthosis. Okay, so to really isolate or bias the gluteus medius, we can start an open chain doing side-lying hip abduction. A really good trick to do this is have your patient do it with their heel against the wall. So in this case, we have a pillow behind Megan's back, so she's reaching back with her leg and biasing her into a little bit of hip extension. Without this tactile cue, many patients have a tendency to drift their leg forward and actually use their TFL, which is too strong to begin with. So we know when we treat patients with patellofemoral pain with level A evidence that the combined treatment approach of working the hip as well as the quadriceps will give you the best outcome. So we talked about the fact that doing closed chain from 0 to 45 minimize patellofemoral joint reaction forces. In open chain, going from 90 to 45 also minimizes those patellofemoral joint reaction forces. If Megan would go up too high, it would actually increase the compressive force under her knee. So it's important to teach your patient, that's perfect, if they're going to do open chain exercises, to minimize patellofemoral joint reaction forces, they should go from 90 to 45. So one of the other things we often look at and typically find pathology with is weakness at the hip. Research shows that the best way to treat patellofemoral pain is to address quadricep weakness and gluteus medius weakness. So here, Megan has a band around her distal femur to help her recruit her gluteus medius, and she's going to do some mini squats from 0 to 45. And she's going to keep going with those, and we're going to make sure her body weight is evenly distributed. What we know from research is squats from 0 to 45 minimize the load on the patellofemoral joint. The deeper you go in the squat, the more you load your patellofemoral joint. So in Megan's case, I'm going to have her only squat from 0 to 45. Another good strengthening exercise to bias the gluteus medius is the standing hip abduction going into extension. So in this case, we're biasing or isolating Megan's gluteus medius on the left. Many patients will also tell you that they feel some strengthening on their right side as well. But the intent of this exercise is to really teach her how to pull her gluteus medius into exercise. Another good strengthening exercise is this sidestepping with a band. Now, we have the band really far down on Megan's MTP joint, And what that will do is it will cause her to isometrically contract her leg and push out into external rotation, which will help her recruit her gluteus medius. So this is a very advanced exercise as compared to putting the band at her distal femur or at her ankles. So I know sometimes you feel like icing is helpful for you. These heavy ice bags that are full of gel, when you put them on your knee and you push them down, can actually irritate the undersurface of your knee. So these are not my favorite for icing. What I really prefer for icing is an ice cup. So you just take a plastic cup from the grocery, you fill it full of water, put it in your freezer. Now what I want you to do, Megan, is peel down maybe about a ½ inch so the ice is sticking out. And you can either sit or long sit, and what you're gonna do is you're going to massage around this area for 5 to 7 minutes. I think that will minimize any compressive forces that this ice pack may give you.